I just turned 30 and I am having a total knee replacement. So let's talk about it. So I'm going to put this in a few different sections. The first thing is talking about my history, and then you can see some items behind me. And those are my essentials, my tips, all of that. I know a lot of people are going to watch this and automatically say, oh, you're 30. Why are you having a knee replacement? That's not a good idea. The purpose of this video is really to explain my history and also to talk about how important it is to be an advocate for your own health. Not every surgery patient knee is the same. There's not a cut and dry model. So there are reasons why I decided to go on this journey, and for me it made sense. It might not make sense for you, but the biggest thing that I have found is it doesn't matter your age. If you're in pain, if you're feeling a certain way, you need to take that effort, be an advocate for your health, find a provider and a surgeon that will listen to you and believe you. So I'm 30. However, my knee has gone through a lot in my 30 years. Growing up, I was a big athlete. My main sports were soccer, basketball, and lacrosse, but I swam, I did kickboxing, I did hockey. I did a lot of things. I was very active. And one of the things with me was I would be the one diving on the concrete. I wouldn't be afraid to do that. And after a while, it caught up to me. So in my early high school years, I had my first real knee injury during a soccer game where I was slide tackled and my knee twisted. In that moment, we thought the worst. We thought, oh no, there goes my ACL, there goes my meniscus, it's going to be this big thing. We went to the doctor and we found it was just a small little cartilage injury. At that point, we said, okay, no big deal, cartilage. We went in for an arthroscopic procedure. My provider took out the cartilage that broke off and life was good. I continued to play sports through high school with some knee pains and injuries every now and then. I had some bigger injuries to my knee that ended up being nothing. So in high school, it was definitely difficult because I feel like I was known as the girl that was always on crutches for nothing major. And that definitely took a psychological toll. Flash forward a bunch of years later, actually 10 years later, and I was starting to feel some severe knee pain once again. I went to go see my original surgeon who referred me to a cartilage specialist, and I met with her. She was fantastic. That was in November. I have my little notepad as well to get my dates correct. So that was in November of 2020 that I met this surgeon. We got x-rays, MRIs. There was nothing major at all. It looked like a little bit of cartilage damage. So we went in for an arthroscopic procedure. And that's where things take a little bit of a turn. So what we thought was an average arthroscopic procedure where they would just go and remove a little bit of cartilage, unfortunately, that was not the case. My surgeon found that when she went in, my cartilage on the inner part of my knee, right here, fell off the bone. A large portion fell off the bone. So, we thought, oh, it's just a little thing. What she did was she took a sample for a future procedure, which we'll go into. When I met with her for that post-op appointment, I didn't really know what to expect. So when I went, she told me that the cartilage fell out. She took a sample because there was a more major procedure called a MACI, or a matrix-induced chondrocyte implementation for the scientific term. With that, they took that piece of cartilage and brought it to the lab and grew it into a larger jelly-like substance. And that led me to March of 2021. So we're talking about 3 to 4 months later, I went in for this MACI procedure. What they did was they took that jelly substance, they cleaned up the inner surface of my knee, and they implanted that jelly structure into my knee. So when they did that, there is a major recovery. It is an 18-month recovery. For 8 weeks, I was not able to put weight on my knee. I wasn't able to bend my knee past a certain point. I was in a machine that straightened and bended my knee for me passively, so I wasn't actively using muscles. Very big surgery. It had a high success rate. Unfortunately, I was in that percent of failure. So in September of 2022, I was having severe pain. We went back in and we saw that my MACI actually grew too much. No problem. We went in, they shaved it down to fit perfectly. For some people, that would be great. It grew too much, no problem. It means it's healthy cartilage. You shave it down, you're great. But in April of 2023, so about 6 months later, I was still in significant pain. But we decided that we figured that the MACI at that point had failed. The next step would either be another MACI procedure, so they grabbed another piece of the cartilage for the lab, or a cadaver transplant. We decided because the MACI failed, the best next step would be a cadaver. The surgeon figured that, my body wasn't taking to my own cartilage. So in April, we went in, we did a cadaver transplant. So they, again, in that section of my knee, they were able to get cadaver cartilage and implant it. Same type of recovery, 18 months, 8 weeks, no weight, no bending, nothing like that. And that was April. January of 2024, so 9 months later, still significant pain. They went in for a revision and saw that a piece of my cadaver had broken off. Again, high success rate, but I am in that lower percentage of the failure. We were told that I could I should be continuing to live my life. Some people don't feel any pain with that chipping in the cadaver, and some people do. I was in that grouping that was having significant pain, so that was January. We wanted to give it some more time, so we said, let's give it, I think, 6 to 8 months, but let's have something, because that's January. In August, I was getting married. We didn't want to go through another major surgery that would impact the wedding, but I also couldn't live with this pain. So in March, we did a platelet plasma transfer where they took my own blood, they spun it, they put the platelets back in my knee. It was an out-of-pocket cost. It was expensive. It worked temporarily, but unfortunately, it didn't, make a huge difference. Right before my wedding in August, I believe it was a week before my wedding, my surgeon gave me a cortisone shot to hold me over for the wedding and the honeymoon. And then in October, we did a second cadaver. So they took out the original cadaver and they implanted a new cadaver. To add on to all of the fun, we found in surgery that not only did the cadaver need to be fixed in this area, but a part on top of my patella also deteriorated. And I had cartilage deteriorating in 2 places of my knee. So the cadaver ended up being in 2 locations, same 18-month recovery, 8 weeks no weight bearing and all of that. And that was in October. We were living in Boston. We moved to Florida in June. I was having some knee pain. It definitely wasn't where it should have been at that point. And as we kept walking, it was getting a little bit worse. And unfortunately, I took a fall in my home. I fell directly on my patella and I fractured part of my patella. In that experience, I had severe knee pain. And it wasn't because of the cadavers. It wasn't because of the implants. It's because I fell onto tile directly. So obviously falling on your knee on tile is going to hurt a lot. And that leads us into kind of where we are now. After about 2 weeks, I had spoken to my original surgeon who suggested I find someone in Orlando, give it a couple of weeks to see if I heal at all from falling. So I booked a surgeon appointment out for 4 weeks. And this is kind of where being an advocate for your own health comes in. Previously, I had spoken to my surgeon about what the next steps would be if something had failed. And he said right away, knee replacement. We had been through so much trauma to my knee at this point. We'd been through 3 technical cartilage transplants that all failed. So that would be the best next step. In preparing for finding a surgeon in Orlando, I did a lot of research and I reached out to a lot of different institutes, centers, hospitals, and all of that. And a lot of providers automatically said, no, we will not see you because you are younger than 50. This was extremely discouraging. I know my body, my surgeon knows my body, but I'm in a new place and people won't see me. I eventually found a surgeon who would see me, and I went to my consult appointment with him. I went to that appointment extremely nervous because I didn't know what to expect. I didn't know if I would go and he would see that I was 29 at the time and immediately say, you know what, let's talk in a few years. But he sat there and he listened to everything I had to say. I have never felt so heard and so seen. He sat there and he said, I know you're 29. I've done a knee replacement on a 21-year-old. Every body is different. Every knee is different. And he flat out said he doesn't like when surgeons just assume you're not fit for a surgery because of your age. Because if you looked at my knee is probably worse than a 70-year-old's knee at this point. It's not even my own knee anymore. So we sat there. He also said, we're not jumping to knee replacement. Let's do the proper tests. Let's make sure we're at that place. We did x-rays, we did an MRI, and that concluded that we needed to do a knee replacement. We did talk about partial knee replacement versus full knee replacement. And I think that is one of the important aspects of this originally, because all of my pain was on that inner part of the knee. He said, okay, we'll do a partial knee replacement. But as he talked through my history and how my patella was deteriorating and maybe the other parts of my knee, we decided on a total knee replacement because my knee is so unstable at this point that he does not want to go in for a partial and then 3 years from now realize, oh wow, the other part of your knee is now deteriorating as well. So let's do that at that point. We decided on the total knee, and that was in September. So my husband and I spoke about it. I spoke with my parents as well because they would be flying down to support me. And we decided on a February surgery date, get through the holidays, settle into our new life in Orlando. So now we're in February and we are a few days from my knee replacement. I went for my pre-op appointment and we spoke about recovery and everything like that. And I'm very excited. I'm also very nervous. I am very confident that this is the right decision. I have been through so much for my knee, and over the past 6 months in waiting for this knee replacement, my knee has gotten so much worse. I'm talking, we're walking for 5 minutes and I automatically feel pain. It's locking, it's going out of place 6 times a day. I'm having to grab onto a wall because of sharp pains in my knee. It's ready. It is nerve-wracking because this is now my 8th knee surgery in 10 years and my 7th in the last 5 years. So, there's always that thought in the back of my mind, what if this fails as well? But they're taking all of the damage out. So I'm very excited for that. So my knee, my patella area will be chrome, and then my tibia will be titanium, and there will be plastic in between. I am also having a Mako total knee replacement, so it's a robotic assisted surgery. So about 3 weeks ago, within the 30 days of surgery, I had to go and get a CT scan of my knee, and that gets fed into the robot, and the surgeon is able to actually go in with the robot and see what my knee looks like and fit this implant or this replacement into my knee specifically. So I'm very excited that it is a customized, it's not a one size fits all model, it's specific to your knee. So some of the things that my surgeon told me, they actually think they're optimistic that I'll take it very well because my other surgeries had a much harder recovery time. I'm not gonna have to sit in bed for 8 weeks and not put weight on my knee. I'm going to be walking before I leave the hospital. There's no limitations. The only limitation is my own pain and just making sure I'm not walking too much to impact the incision. But because of all of the experience I've been through, I'm not too nervous about recovery. I know the first week or two is going to be difficult considering the fact that there's going to be pain, but I'm taking it very seriously. I have home PT coming and a home nurse coming the day after surgery. So I'll talk to them about recovery plans, and I'm just honestly so excited. So knee replacement is coming, very excited about it, and that is my history and where we're at now. Now that you know my history and why I made the decision to have a total knee replacement, I'm going to tell you about my post-op essentials and some tips and tricks. The first thing is equipment that I got from the surgeon and from the hospital. I will be using a walker. I've never seen a walker that has 2 wheels on each side. Very nervous to use a walker. I consider myself a crutches queen. I think I could be in the Olympics for using crutches because I was on them for so long. Walker, very awkward on a walker. But the benefit to this versus crutches is they want me to be putting weight on my knee right after surgery. So this will help guide me while also providing the comfort and support and taking some of the weight off. The next thing is an ice machine. So this is an ice and compression machine. This is Iceman Classic. I had a different one for my other surgeries. I did have to pay for this out of pocket. However, I found that it was worth it. So inside, you have where you put your ice and water. It connects to this tube, and then the tube connects to this pad, which will go onto my knee. I can then use this. If you have a shoulder injury, a back injury, you can use this again. This provides both compression and ice. I usually keep this on all day, but it's about 20 minutes on, an hour off for the first few days consistently. And then after that, it's as needed. I absolutely love this. I think ice is so important. I know some surgeons don't like ice. My aunt had a knee surgery and her surgeon didn't believe in ice. I don't know what I would do without ice. I use it for swelling, for comfort, everything. So the ice machine. The other nice thing is this is what wraps around your knee, and I will bring this with me the day of surgery, and they will place it for me and wrap it for when I leave so that when I go home, I'm ready to plug it right in. I will also talk about this in a little bit for my tips and tricks because ice is important, but it's hard to get a lot of ice. That is it for equipment from the hospital, but some other things that I really like. I have this strap, so it isn't like a flimsy one. It's actually hard, and you can see you can bend it a little bit, but this is great for doing exercises, for straightening your knee, getting that range of motion. I liked that it was hard and not flimsy because, and you can see Luna likes it too, but it makes it easier to get that straight leg as you're pulling it up. So this was cheap on Amazon. I can link it in the description as well, but highly recommend. My last thing I am going to get controversy over. Again, I use this because I like it with my experience has helped. I have this lovely knee pillow. I use this for elevation all day long. I've also, with my other surgeries, I slept in this because I felt more comfort. If I were to roll, I was protected. The reason why it's controversial is because people will say when you rest your knee in here, you're not getting it completely straight, which is true. One of the important things about post-op recovery is getting that straight in your knee so you're not stuck at a bend. I have found ways to make this work. And when you're sleeping, you need that comfort and protection. This one specifically comes with an extra pad that will help you get that straightness. So at the end, you can rest your ankle on here so that you can't bend it, so that it is straight. I absolutely love this. I could not go through this surgery without this. But again, if it's not for you, you don't have to use it. And I will link this in the description as well. So that is my equipment. The other things that I have are bedside baskets, and I have 3 of them. My first basket is medications and self-care. I have already picked up all of my medications from surgery, which I really like that this surgeon did that because my parents aren't having to drive to a pharmacy after my surgery, have me in the car waiting to pick these up. I also have some self-care items. So I have my Sol de Janeiro body spray. If I'm smelling a little funky, I can add that. I have some body butter. After surgery, the dry skin is insane with that healing process. So I add this on, not near my incision, just in other areas. I also have gum, hand sanitizer. I just have my Bath & Body Works here. Aquaphor for my lips, and as my incision is healing and when it is healed, not right after surgery, this can help with massaging the area. And finally, alcohol swabs. This is not for my incision either. This is for smelling. I get very, very nauseous after surgery. These do the trick. And I don't know if you've heard that before. I've used it in the car. I've used it in multiple circumstances. So I also have alcohol swabs. And then everything else is what I've been given. So I will be on Percocets for the pain. I try to get off of them as soon as possible after surgery, but it is very, very important to take them early on to avoid the pain in the first few days. I also have a nausea medication, aspirin for blood clots, a stool softener, and a muscle relaxer. So this is my self-care and medication basket. My next basket is my snack basket. So my other surgeries, when I wasn't walking much, I had a bigger snack basket, not necessary. For here, I just have some of my granola bars. If you haven't had Bear Bells, they're my favorite. Shout out to Bear Bells. I get these online and at Trader Joe's, but I keep a few of them in here. So if I'm about to take a medication that needs food, I can take a few bites. My liquid IV, again, most of the time I'm able to get up and make it. But if someone brings me water and I want to add some electrolytes, I have it with me. And then just some like gummy snacks if you want something gummy. So I'm gonna keep this. I usually have a TV table that has all of my baskets and then another one for my ice machine to have it a little elevated. And my last basket is my activity basket. So obviously I will be on the couch, we'll have a TV, but I don't wanna be watching TV all day. So I have some yarn for crocheting. I have a coloring book and some colored pencils. And then I have my current book that I'm reading, and I read very quickly, so I have a second book as well. So these are all gonna be there. This is probably one of my biggest tips. Have a basket ready with your meds, with your self-care, with anything you need, and especially for things you wanna do. You know, people will be there to support you, but it's easier to have what you need right there so you can just grab it quickly. As I am progressing through my surgery, I will, you know, use it less and less. So, tips and tricks. My number one, like I just said, have these baskets on you. I have my activities, my meds, my self-care, and my snacks. Easy to grab. You can move them away as you progress past surgery to force yourself to get up. But those first few days when you're in pain and you need something quick, when you need a quick snack for your meds, whatever it may be, have these on you, have them ready to go, and it'll cause you a lot less stress. My second tip, we're going back to the ice machine. Ice is your best friend unless your surgeon tells you otherwise. Surgeons I've used have always said ice is your best friend. You do not want to overdo it. Follow what they tell you. I would love to have ice on me 24/7. Unfortunately, it's not always the best thing. So listen to your surgeon, 20 minutes on, an hour off. Stay consistent with it. If you see swelling, throw that ice back on in the coming days. I used ice for those 8 weeks I wasn't walking. I will use ice after the first couple weeks of this surgery as well whenever I see swelling. But with an ice machine, my greatest tip is the use of water bottles. So my first surgery, I had my parents go out and get huge bags of ice every other day, and we'd fill this with ice, it would melt. My physical therapist told me to freeze 4 water bottles. 4 is a lucky number because you could do more if you want. I would always put 2 frozen water bottles with ice, cover it up, and use that. And that ice would be in there and it would be melting, but it's in a water bottle. When this was melted, I would then exchange it for the other 2, put the new 2 in, the original 2 would go into the freezer, and it's a constant cycle. You're not having to go buy more ice because you've frozen it yourself. This makes it easy because you're just dropping it in there, and you're able to also keep track of how much you're using, how much you're icing, how fast they melt, and stuff like that. That is probably one of my greatest tricks. My next tip is med maintenance. I said this a little bit ago, but I know sometimes it's scary to take narcotics and Percocet and Oxy and all of those medications. They are truly, truly important those first few days of surgery. You just have to be smart with it. I always stick to the schedule the provider gives me, where you're taking it the first few days for med maintenance and then you're weaning yourself off after. For me, I'm having a nerve block. You'll have numbing. So that first day after surgery, really, you're going to feel good. You're going to feel like, I don't need medication. I don't need anything. The second that nerve block goes, you're going to feel everything. So it's better to, take care of it early on to avoid that crash. Otherwise, you're going to be in so much pain. So take it early, and then you're able to wean off once you're feeling better. Movement and PT is my next tip. If you're able to walk. You will see that you will get so stiff sitting there, whether it's in a bend, in a straight. So it's so important to get around, to walk around, and to, get your muscles moving, get your joint moving. I'm very excited that I'm able to do that. I'm not having to sit in bed for 8 weeks this time. And that goes into PT as well. PT is so important. So take it seriously. Go to the appointments, do your PT at home. The more you do your PT, the faster you strengthen your muscles and get your knee ready, or any joint, the better you'll be in the long term. It's going to hurt at the beginning. Be prepared for that. Take some Tylenol before if you're not on the narcotics anymore. So prepare yourself, but push through that pain, but never push too much. If you're ever uncomfortable, just talk to your physical therapist. They're there for you. And if you're not honest with them, then you won't see those results. And yeah, that was the ice machine, med maintenance. Overall, again, my tip and trick, like I said at the beginning of the video, is be an advocate for your own health. I'm 30, I'm having a total knee replacement, and I don't see anything wrong with that. I have been through a lot with my knee, and this is the best decision for me and for my family. So if you're feeling something or you feel like you're not being heard, talk to your provider, find another provider. You need to do what's best for you and for your body. So that is my experience. These are my tips and tricks. These are my essentials. You don't need to use them. You can take whatever you want from this video and leave a comment if you have any questions. I want to be an advocate for you. I want to help you. If you have questions or concerns, let me know. I have been through a lot with my knee, but this goes for any condition. And the other thing that I've learned a lot of from this experience is empathy. This is my experience, and I'm not taking away from your pain or someone else's pain. And people are going through a lot worse, and people are going through a lot less. But everyone is experiencing something for themselves. So you need to do what's best for you and understand that people are also going through that. And sometimes speaking about it is the best thing you can do. So I am about to go to my knee replacement. I'm posting this the day of surgery, and I will be doing daily updates following for probably a couple weeks after. So I'm gonna go in for surgery now, and I will keep you all posted for my recovery. But again, leave me questions, concerns, anything like that. And I hope you also can learn to be an advocate for your own health and go through things that maybe others question, but you need for your own body. So with that being said, I'm ready for this adventure, and we'll get back to our normal Disney and Universal content soon and see how the parks are post knee replacement.